Yes.
Action. This is a Sen's skin hook retractor. It's a skin hook from this end because it has these 3 little hooks. But if we need it for retracting, it can open because it's smooth. So a Sen skin hook retractor. Iris scissors, these are curved. If you look at these, there's a slight curve on them. Most of our instruments will come straight and curved. Iris scissors are sharp and sharp to cut tissue and also suture. This is a splinter forceps. This one is a very sharp one, and it's used for pretty much local on top, like when you get a splinter or a thorn. And this one can go inside. Has this little needle part in there, so when you're inside the tissue, you know when you've reached it because this thing will stick your finger. This is a tuning fork you hit on the base of your hand, hold below the fork, and this will go in the middle of the person's forehead or behind the ear, and it is for a Rinn-Weber testing. These are, she's only put one here. These are bone scraper. One side is sharp, the other side is smooth. So if we need to scrape anything off of the bone, we can use this. These come in various sizes, but if we just need to scoop out anything, you can use the smooth side. This one you can probably see better. This one is sharp, this is smooth. So we scoop with this side, but scrape the bone with this side. These are suture scissors. They have this hook in them which goes under the suture. When you're under the suture, you turn them so that you cut closest to the skin, and then you would remove the suture with a thumb forceps and pull it out towards the wound. So these are suture removal scissors. This is an ear curette, smooth both sides. You as a medical assistant will never use these, but the doctor will. And this is to pull out maybe a foreign object or cerumen, earwax from the ear. But if you've got to go down the canal, you can damage the eardrum. So the doctor will only use these, but you would get it for him. Alice tissue clamp. These are used in vasectomies, and it's to bypass a vessel. If I have a vessel that I need to go past, I don't want to damage this vessel, but I want to get this vein here. I can go this way and this vessel is clear. It's not being damaged or clamped in any way. So that's the hole here. We'll go past that vessel. These are Alice tissue clamp. This is an occluder, eye occluder. I'm not going to put it up in my eye because then you'll see my face. But it goes in front of the eye to obscure the vision so that the patient will read with the opposite eye. And this is just done on visual acuity. Then we have the mosquito straight hemostat. Again, these come in curved and straight. So here's the curved one. There is a slight curve on it. And this is the straight one. But they are fragile and delicate instruments. So these are the smallest instruments in the hemostat that we will use in family practice. Then we have the bayonet. The bayonet is to take foreign objects out of the ear or the nose, and it is named after the bayonet that goes in a musket, so that when a person has shot the last round, they will have the knife that they can fight with. So it's a bayonet forceps. This is a blade remover. The blade goes in here, you press down and it will take it away from the blade handle. I don't use them. I think they're dangerous, but I still have to have it out for you. Another female torture instrument. This is a uterine forceps. What they do is they put gauze on the end, dip it in podophyllin, which is like an acid, and paint the lesion on the woman's cervix. So this gets rid of it. It's very corrosive, as you can see. If it corrodes stainless steel, you can imagine what it does to your flesh. This is a small skin retractor. These little hooks go into the wound. You hook it either side, and then you can open it from this end here. Very similar to the chest retractor, only on a smaller scale. And this is an anoscope. You have to always make sure this is in. This is lubricated, placed in the patient's anus. Then this is took out so they can see anything in the anus. So this is usually on males, sometimes on females if you have hemorrhoids or something like that. That's it.